A mother who dies in childbirth leaves other children motherless and families disrupted. To take care of the mother and to protect her is really to preserve a whole local community.
Thanks to expert knowledge and facilities, a woman dying in childbirth in the UK is practically unheard of. However, 1 woman a minute dies in childbirth globally, and each year approximately 4 million babies die within the first month of life. For award-winning midwife Fiona Laird, a trip to Darfur marked the beginning of medical aid films.
My clinic was a large straw structure, no blood products, no drugs, just my hands, my eyes, my ears, and some wonderful traditional midwives that had come from the villages. One of the really sad things I saw in Darfur was babies coming to the clinic when they were 3 to 5 days old with tetanus because their cord had been cut with a dirty knife. We didn't save one of those babies. Now, that's just such a simple thing to teach people and would make such a difference.
Fiona teamed up with Professor Eric Jonio and Dr. Natalie Greenwald to create a new way of teaching the traditional birth attendant.
The rural areas are where women are dying in droves, and they're dying of simple things, simple preventable things.
So the structure of medical aid film is to identify a problem in a particular country. We design a storyboard to make a film or an animation, and then we produce a film, make sure that it is absolutely adequate from a medical point of view, but also from a cultural point of view.
Gaining insights into people's local beliefs and local resources directly through accurate feedback and incorporating that feedback into our storyboarding process, I think makes MAF unique.
And so Medical Aid Films was born, a filmmaking charity providing internationally approved education to healthcare workers at grassroots level for free.
So a TBA, a traditional birth attendant, is an unqualified midwife that comes from a rural community and who's helping women during labour, during childbirth. The problem is that they have very little access to learning skills.
In certain countries there are 6 or 7 dialects just travelling from one region to another. Printed material will often be useless. So teaching through animation where there is actually no language is a huge advantage in those cases.
The fact that in rural area women live miles away from clinics and hospitals. By helping the training of the local birth attendant, we hope to have an impact.
Our idea was to deliver education at source. There's no point telling people to give a particular drug to manage a problem if they have no access to that drug. There's no point telling people to get their patient to hospital within half an hour if the nearest hospital is 4 hours away.
And so Medical Aid Films produced its first animation for the traditional birth attendant.
Our safe delivery film highlights a few basic healthcare messages around childbirth. How to wash hands, how to sterilise the instruments by boiling them, how to cut the cord cleanly with a clean blade and with sterile ties, how to wash the baby and dry the baby after birth, how to deliver the placenta safely. Fiona's experiences in Darfur showed us that these basic methods can save lives.
Comfort Momo is one of Medical Aid Films' expert advisors. Using her knowledge and experience in the field, she ensures that film content is both accurate and relevant.
From my experience and from my travels and some of the work that I've done in African countries, most of the TBAs that I've worked with, I found it very, very useful. At least they can see, they can visualize and demonstrate and use the skills acquired.
Now, there is a need to produce films for all the different levels of healthcare, including junior doctors, obstetric nurses, medical officers.
Postpartum hemorrhage is a big killer. There are first-line manoeuvres that can be taught in the management of postpartum hemorrhage that could save many lives.
In terms of the Millennium Goals, we're looking to save lives. We're looking to reduce maternal death and child death as well.
Another example is neonatal resuscitation. Teaching immediate methods to protect the baby's airway and to help resuscitate the baby will have a huge impact.
The Medical Aid Films website will become the main platform to view and download films. Until internet access becomes readily available to all areas, however, Medical Aid Films supplies DVDs to NGOs and distribution partners who already work in the rural areas. So far, Medical Aid Films have been screened in 8 countries. We need to raise £3 million to produce The Arc of Life, a suite of films that will train healthcare workers across the globe on issues ranging from family planning to conception, safe pregnancy and delivery, neonatal care, and improved infant health till the age of 5. For more information or to make a donation, visit www.medicalaidfilms.org. Overheads are minimal due to gifts including capital equipment, office space in central London and services in kind. This means that your donation goes directly into making life-saving films.
Film is knowledge, and knowledge saves lives.
I truly believe, had I been able to use medical aid films and leave them behind, mothers' and babies' lives would have been saved.